Go ahead.
Hi, everyone. Welcome to the webinar for Shakthi Health and Wellness Center. This month, we're going to be talking about chilling out and boosting your health. It's the science of cold exposure, and it's about simple daily practices to help us improve our immune system and longevity. I have a personal interest in this because I'm the person who's always the coldest person in the room. I'm wearing a parka in the middle of summer and I'm always cold with just the warmest clothes. Everybody's always laughing at me, thinking I'm strange. And now I have embraced the cold and I wanted to talk about why and the journey of how, because it is such an amazing tool, just like so many of our lifestyle tools are to help us increase our longevity, improve our quality of our health, improve our mood, lower inflammation. So there's a lot of science coming out in cold therapy, but I also want to make it sure that we're staying safe because there is also hypothermia, which is the negative side of too much exposure. So what we want to do today is clarify the safety values, but also show how important cold therapy can be as a tool in your toolbox for improving your quality of health. I want to introduce Kim Salzmann, our health coach, who has been working with our patients and giving us amazing advice on how to implement the changes in your life that's going to improve your quality, as well as how to implement our program and use the things we have at Shakthi to help people on their health journey. So, welcome, Kim. Thank you for being here today. But we want to talk about, Kim and I, is the amount of data that's coming out is amazing. There's a lot of studies coming out of Denmark. A Danish researcher named Susanna Soberg at the University of Copenhagen has been doing studies on cold therapy and how it can really increase something called brown fat, which is fat that is under the microscope brown because it has a lot of mitochondria on there. We have mitochondria are energy producers in our cells, and they are loaded with they're just loaded in all our muscles and our brain and most every organ. But fat that has a lot of mitochondria in it has brown fat versus the white fat, which we think as inflammatory and negative for our health. So babies have a lot of brown fat, and we lose that capacity to maintain our brown fat as the major fat as we age. So cold therapy is one of those things that has been shown to increase brown fat. It also boosts our metabolism and it can help with insulin resistance, which lowers our fat percentage. When you lower your fat percentage and relatively increase your muscle mass, you can increase your metabolic rate. It also has some data on lowering inflammation in our body and enhances cardiovascular health. So that's kind of what we're going to talk about today. And there's a ton of information coming out on cold therapy, Instagrams, a lot of YouTubers, and we want to discuss what's a reasonable approach because in athletes there are things like cryotherapy and ice baths and cold showers. There's outdoor cold exposure, how long, there's cold water swimming, ice plunges, there's baths, there's a lot of information out there. So we want to basically tease it down and then our question and answers, we can fine tune it for you guys. Um, Kim, what are your thoughts about what you're hearing about the cold therapies?
I'm hearing a lot too from my clients. There's a lot of interest there because, like you said, it's all over social media. You're seeing all of that. Wim Hof made it very famous a few years ago, and so
Iceman. Yeah.
yeah, and it's great. It's a wonderful tool to have, but just like any tool, like you can do something too much, right?
Right,
And so it's really important to understand, honestly, in a way, dosage and
right.
safety when it comes to cold therapy.
Yeah, that's a good point. So that leads us to our next information is safety first, right? It's in animals, in studies that have been done on animals, cold exposure extended longevity, but it's mixed in human studies, mostly because we need to find everybody's different. And as we age, we start to lose things like our thermoregulation. So we want to make sure that in our capacity of where we are in our health, that we are implementing these tools. It's not a one size fits all. Um, the first issue is there is a public health issue about cold exposure. It is a health burden and it's heightened in older people due to their reduced ability to regulate their body temperature. And there's a lot of problems when you have multiple health issues, specifically cardiovascular issues, uncontrolled diabetes, maybe kidney or liver failure. You want to be very, very cautious about some of these things and maybe run it by your physician on how to kind of incorporate something like this. It also is highlighted because we have an increased social isolation. And so that has become an issue for people when they're kind of trapped in their house. We hear episodes of like people losing their heat in the winter. By no means is this one size fits all or something you should be doing all the time, every day. So really has to be kind of fine tuned. And um, Kim can help also with guidance. Any your providers can also who know your health issues well can help you with some of the guidance with this. So, Kim, any idea, any let's back up there. Sorry. Um, you can start. I don't want
Okay.
to say anything. Yeah.
Yes, no, I completely hear what you're saying and I agree. Like, because I mean, if you go on Instagram, like you can find things and they say very extreme things, right? Like for curing cancer and all of these other things. It's not that these aren't tools that could help you in these situations, but definitely talk to your doctor. This isn't something to forego other therapies that you're doing because you're seeing something on social media saying that this is the fix all of all that. Because if depending on who you see, that's what they're going to say, for sure. Like my son has even mentioned people that he's seen on Instagram and how what they talk about with the cold therapy and the extreme results that they've seen. The other piece too, even like something to think about too, and I believe that Dr. Rao is going to talk about this as well, is that like the effect on women versus men is also significant, as far as and also like where you're in your stage of life as a woman. And so that's also something very important because you can overdo it and mess with your hormones as well.
So one of the things we want to clarify is that there can be a public health issue with cold exposure. It is a substantial health burden because it's very heightened with older people due to their loss of thermoregulation, meaning they can't regulate their body temperature as well. And if you have chronic health issues, this is even more problematic. So if you have heart disease or uncontrolled diabetes or kidney or liver function, this can be a big problem. There's also a public health issue because of isolation socially. No one is there to check on people who are kind of progressing along the spectrum of hypothermia, which I'll get into. And so it's very important for people to be aware to seek help when they start to have issues of cold temperatures and hypothermia versus cold stress. So again, this can be an issue, so we want to make sure that people understand the difference.
Yes, thank you, Dr. Rao, for really pointing that out because this is really important to highlight and understand that as we age, our regulation really does change. It isn't just our perception, it's actually happening in our body. So thank you for sharing that. That's very
Sure.
interesting.
Let's delve a little bit more into hypothermia because hypothermia is actually not cold stress. It is not a desired outcome. So, with cold stress, what we're going for is we're normal mental status, but you're shivering. So, that shiver response actually is what causes a lot of the health benefits. A controlled amount of shivering is the goal, but it's not extensive. So, you're functioning normally with it. You're able to care for yourself with this. You're core temperatures are probably 95 to 98.6. 98.6 is the normal body temperature we're kind of always shooting for. So at this cold stress, which is the desired outcome, we're not having any problems such as in mild hypothermia where you're alert. This is when your health, this is the warning signs. Your mental status may be altered. You're shivering, but it's more frequent and it's much more often and sustained, and you're not functioning normally. You're not able to care for yourself, and your core temperatures are now falling into the low 90s. And then moderate is even a decreased level of consciousness. So you're not kind of aware, and you can see if someone's actually in this situation and they're alone. It's very hard for them to even know that this is happening. This is why we want people to check in with people. Like if you have family members that live alone in the winter, you want to keep checking in and making sure that they're okay. Consciousness or unconsciousness without shivering so that you're alert, but not always. Your core temperature is falling into the 80s here. And then with severe, profound hypothermia, you're actually unconscious, you're not shivering, and your core temperature is under 82. And so this is a lot of times with cold exposure with water. So if you're in like a lake or a water and you're getting really kind of confused, it's too cold, get out, you got to warm up. So this is kind of the a good slide to just summarize what our goals are and what bad looks like.
Yep, we want to highlight that this is cold stress, not hypothermia. And like if you are going to do a lake or something like that, do that with somebody. Like, and maybe
Absolutely.
even take turns. Have the one person standing on the shore and then swap so that you both are clear-headed.
Absolutely. Um, So one of the things our body is amazingly adaptable, right? So this is called the hormetic stress model, where cold exposure, when it's applied in a safe way, it causes a mild stress to the body, and that can trigger adaptive beneficial responses like exercise, like fasting. They're stressful. We're actually inducing stress on our body, but we're creating a change that actually helps us age better. So just like fasting and the difference between fasting and starving, this hormetic stress model with cold exposure is cold stress versus hypothermia, right? So everything has like a scale where we want to balance it.
Yes, like our bodies are able to respond very well to small amounts of environmental stressors. I mean, even exercise is a hormetic stress, right? When we're stressing our muscles. So it's not that all stress is bad. We go back to that dosage. It's that amount that we've got to really pay attention to.
Right. I think one of our previous webinars, we had said something like that it's not the actual stress that's bad, it's the lack of recovery.
Mhm.
So with cold exposure, you want to make sure you're seeing the signs where your body is saying, I need to recover longer. So please pay attention to those symptoms. Okay, so what did the data show for the advances? Again, this comes from a lot of the studies that have been done out of Denmark. Chronic inflammation can cause accelerated aging. I've said that multiple times that inflammation is the key to kind of causing illness, and lowering inflammation can help our body heal as well as slow down aging. So, cold exposure has been shown to reduce chronic inflammation, and it enhances what's called antioxidant defenses. So, oxidative stress is when there's things like pollution, water quality being poor, activities that we're doing badly, like sitting too much, not moving, maybe our food quality is low, we're not getting enough nutrients. That's oxidative stress to our body. We want antioxidants, and cold therapy actually increases reactive oxygen, reduces reactive oxygen species, which can be an antioxidant, and it improves our metabolic health and it can improve our cardiovascular health. So, um, so the other big area that we can have benefit with is inflammation, right? The same kind of concept. So we have oxidative stress that goes down and also inflammation. This is the where inflammatory markers like cytokines are being measured, and they're showing that they're lowered by cold exposure. So chronic inflammation ages us. So it's inflammaging. And so that is a big hot topic that's out there right now in all these different ways. And this is where a lot of the cold therapy videos are coming out. And like Kim said, they're sometimes very excessive. They make claims like they cure cancer, but what they are doing is lowering your inflammatory markers in your body called cytokines. And cold exposure may lower the pro-inflammatory cytokines. So we have anti-inflammatory cytokines and pro-inflammatory cytokines, which are basically messenger systems from our white blood cells to the rest of our body that's either recruiting help or telling everybody to calm down. So the other big area is inflammation. So we talked about antioxidant effects, and now we're going to talk about inflammation. So there's antioxidants and anti-inflammatory. And this is the role of where cytokines come in, which are messengers that communicate to the body to pull our army in and our fighter cells in, or to tell the body to calm down. And so controlled cold exposure may lower pro-inflammatory cytokines, meaning the ones that keep calling the alarms, and shift us to saying, hey, we're good, settle down, let's calm down. And aging can also be associated with inflammation. So inflammation and aging is associated with it. So that's the term that says that as we have chronic inflammation, we age faster. If we have less inflammation, we age slower.
And that's where like really just focusing on shifting that immune balance. Like we talked about in our last webinar, we talked about stress and its effect on our immune system. Now we're talking about something that can help improve our immune system with less inflammation. And as we think about this season, right, to try to embrace the cold, like you said in the very beginning. Like this is where we can embrace the cold to then help us with these age-related diseases and even like colds and things like that that could be combating us in this season, during this season. It's super exciting to talk about another lifestyle tool for health.
Right. So let me just spend a little time on cytokines itself. So cytokines, like I said, are messengers. And when we are inducing cold exposure, we are stimulating something called IL-10, which is an anti-inflammatory cytokine. And we are reducing inflammatory cytokines like IL-2, IL-6, and IL-8. Some of these we can measure in your blood. Some of these aren't covered by insurances. There are labs out there that measure these things. We do it for our very chronically fatigued patients or chronically ill patients so we can figure out, what pattern of cytokines is going on. It reduces something called NF-kappa B, which is also very pro-inflammatory, and increases something called AMPK, which is an enzyme that functions as the body's master energy sensor, and it plays a vital role in managing cellular energy balance and overall metabolic health in humans and animals. And there's like a seasonal shift with it. We go into kind of AMPK mode more in the winter. And so this is another time to harness AMPK, which is regenerative for our body. It slows things down, gets rid of it kind of helps us get rid of cells that aren't necessary, cleaning house, kind of conceptually like what we want to do more in the winter, which is slow down, be more, center in, kind of be more with our family indoors. We can kind of find more comfort, but so there's a clearinghouse of things. So that's kind of what AMPK does. Sorry, let me get to. Okay, so another big fabulous area, which is what motivated me to really delve into the concept of cold therapy, was because of this metabolically active fat. It's such a great concept of this brown fat, and it increases energy expenditure. So, weight gain, we're kind of always struggling. The two biggest things I see in my practice is weight gain and fatigue. And so, regardless of what people are coming in for, those seem to be a player. And so, as we age, there's a harder time to lose weight and lose fat and maintain muscle mass. We have to work harder and harder for that, especially in menopause. This is a big, big issue in menopause where we're just gaining fat. So one of our cool interventions can be by activating this brown fat and increasing better glucose and lipid metabolism, because when we have more brown fat, we have better insulin resistance, which then gives us better glucose control and lipid metabolism. So, Kim, where have you discussed with patients where brown fat's located and what happens there? How do you talk about it with your patients, with your clients?
Well, I like to really emphasize that it's the kind of fat which produces health, right? And like what you were just talking about, unlike white fat, which like stores the calories. Like those are the white fat is like what we're seeing in the mirror that we're not happy about, right? That
Mhm.
brown fat, you're not going to see that. It can help, it helps you give your heat, it gives heat, energy, helps with blood sugar and fats. I mean, and adults have it in small amounts in like the neck, the collarbone, and the spine. But by doing things like cold water therapy or cold therapy, we can increase the amount of these in our bodies, like we talked about, which just helps improve all these other things overall.
Yeah. It's a great summary. And so, babies, the pudgy, cute babies, they have a lot of brown fat, right? And even toddlers, like, when we see kids, they're just oozing with fat, but their burn rate is so high. They're growing, they're taking in calories and they're growing so fast. And that kind of fat, metabolically active fat changes as we age. And unfortunately is kind of something we have to recruit again as an adult. So, um, what are these increased metabolic effects that we can see? So, regular cold exposure has been shown to promote the conversion of white fat to brown fat, and it increases mitochondria, right? So, mitochondria is not just our ATP producers or our energy producers. The powerhouse of our cells is what we remember it to be. It does way more than that. It regulates our immune system. It helps with glucose control. It helps us use our foods and take energy from our foods, take energy from sunlight, and turn it into energy within our body, makes our organs work more efficiently. So it is a critical part of aging. In fact, some would say that aging is directly related to the health of your mitochondria. So this is another tool to help us with increasing that mitochondrial benefit. What is seen oftentimes that we have, and this was also one of my first exposures to cold therapy, was seeing this whole body cryotherapy, which is this short, intense exposure to extreme cold temperatures. I'm talking negative-degree cold temperature. And it's a special chamber that's usually in gyms and spas. And it's often used by athletes to aid in muscle recovery after a workout, and other people use it to reduce inflammation, help with pain relief, and improve mood. A lot of the science behind it is kind of evolving, and it's not FDA approved for any medical conditions, but you'll see it very easily accessible through different gyms and spas. The thing about it is that this whole body whole body cold therapy is increasing the activity of the natural killer cells, lymphocytes, and immune cells, which are involved with the body's initial innate defense mechanism. So they're first line activators for, and this is where, Miss Wim Hof breathing and his cold therapy, he's called the Iceman. He has an app. He talks a lot about how his immune system is so strong, and they've actually done studies on him with his cold therapy and his breathing technique to show that these cells actually increase when you do these things. And at first they thought maybe this was just him, he's genetically gifted, but then he's taught people these techniques and they have the same response. So there are definitely changes in these cytokines with TNF alpha and natural killer NFK beta, and all of these things that promote this awesome anti-inflammatory effect. So the other big area we have is cardiovascular benefits. So cardiovascular disease is still the number one reason why people are dying in America. So we need to also find tools that will help. Now, there's a little bit of a caveat with cardiovascular, because if you have cardiovascular disease, then you want to be cautious because you may have that same problem as aging in terms of thermoregulation, and there might be a strain on your heart with extremes of anything. So that is someone who definitely should get clearance with their cardiologist or their doctors, and also very tiptoe their way into exposures, because cold therapy induces constriction of the blood vessels, which then increases the return of the blood to the heart, and it maintains a level of benefit with the circulatory system. It increases your oxygen demand, and it can increase your dilation of your blood vessels and eventually actually improve coronary blood flow. But in the process, it can cause, some vasoconstriction, which is, something that isn't favorable for some people. It activates the parasympathetic nervous system, it lowers heart rate, and it eventually also improves heart rate variability. Kim, can you talk about a little bit about how heart rate variability can be used to monitor health benefits?
Okay, so yes, I can absolutely explain heart rate variability, HRV. So imagine like your nervous system has like these two horses pulling a carriage together. Okay, one horse is the go horse, and that's a part of you that handles the stress and the pressure and the quick responses. And then the other horse is the whoa horse, right? It's the part that helps you calm down, recover, and rest. When your body is healthy and resilient, these two horses are communicating constantly, and they're like pulling. They adjust to the terrain, like what's going on with you, share the load. They respond smoothly to each bump in the road. And that's, excuse me, this adaptability, this gives you a high HRV. Okay. But when your HRV is low, so it's like counterintuitive. We always think like lower numbers are better, right? And here, like, it's like if you higher HRV is what you're shooting for, because when your HRV is low, it means that your horses aren't adjusting anymore. It's like they're tired, stiff, excuse me, or stuck in one mode. So maybe the stress horse has been pulling too hard for too long, or maybe the calm horse is worn out. So either way, the carriage just starts to feeling like jerky and unstable. And in real life, That looks like getting overwhelmed more easily, feeling drained even after sleeping, craving or irritability creeping in, workouts taking longer to recover from. Stress is hitting harder than usual, maybe. So, a low HRV isn't a failure, it's just simply your body saying, my horses need a break. My system is losing flexibility. Okay. And flexibility is the whole point. That's one reason why we're talking about this tool today, is really helping our body become flexible with stress, metabolism, everything. A flexible nervous system can handle that stress and bounce back quickly. A rigid nervous system struggles, and that low HRV is your early clue that your body needs a little bit more care or rest or balance. So if your HRV is low, like think of it as a little whisper in your body saying, like, slow down, support me, let's get these horses working together again. So I just wanted to give that story because I know for
Great.
me, when I started learning about HRV, it was hard to understand. So
Yeah, no, it's a great explanation. And I think you're right. Everybody's thinking that low numbers are better. And there's a lot of great tools now that also monitor HRV. I think we discussed those in our last webinar. If people are interested, they can go back and check. But the heart rate variability is a really nice feedback tool for us to know how balanced our body is. And just like blood vessels are better when they're nice and flexible, so is HRV. HRV should be nice and resilient and bounce back from stressors. We're not going to be living in a bubble. Everybody's going to have stressors. We just want to be able to bounce back from them quickly. So, what the positive thing about ANS, the autonomic nervous system, is that regular cold exposures can enhance this vagal tone and fitness in healthy individuals. So, again, be cautious if you have cardiovascular disease, but it actually can improve our heart rate variability, and that you can look at with different monitors. So we had that it enhanced antioxidant defenses and lowers oxidative stress, reducing these reactive oxygen species and protecting cells from, oxidative damage, which we talked about can be something from just living in our life with the air quality, the water quality, the foods that we're eating, and our lifestyle choices, but they do contribute to aging. So the next thing is the longevity part. There's a lot of hype about, cold therapy and potential cardiovascular and longevity. And in some models, the lower core body temperature or periodic cold exposure, it does correlate with the longer lifespan and reduced aging. And so cold exposure has been linked to potentially boosting health span, which is having good quality health, not just aging till 100, but also living your life healthy and gracefully aging for those years. I know we're talking about this over and over again, but it's not good for everyone. And so thermoregulation declines with age, and most evidence is from model organisms or acute controlled cold. Not all cold exposure is equal. So we definitely need a lot more research on this. And populations that live in cold climates often have a higher mortality. So this is a little bit confusing to people saying, well, you're telling me that it's going to make me age better, but then these people are dying faster. And that's really because of their maybe inability to regulate that thermoregulations and get into that hypothermia, which is why we kind of talk about this so much. And as people get older, their ability to handle cold safely diminishes. They have slower heat production, they have worsening circulation, and their resilience is lower. So the cold can result in more harm. And so remember, a lot of our studies are coming from the animal studies, but keep watching for the stuff coming out of Denmark because she is doing really cool stuff in terms of understanding how it affects humans. Um, there isn't any long-term lifestyle cold exposure studies right now, so we do want to be a little bit cautious. Okay, so we talked about this. I'm just reiterating that cold affects the body by boosting circulation. It wakes up your nervous system. It can activate brown fat. It can actually increase our mood also by improving things like norepinephrine and dopamine, which are our neurotransmitters that actually make us get up and go, want to take things on. So it's a kind of movement, also our just our ability to have motivation. The other aspect of cold and the immune system is that cold can increase helpful immune signals, and it can help with stress resilience and increases the stress response, but then also activates dopamine and norepinephrine, like we just said. So now we're at the point where there are autoimmune conditions. So this is a question I get a lot for people for cold therapy. One of the reasons I actually was interested in it is that cold reduces has been shown in certain autoimmune conditions like multiple sclerosis and in inflammatory bowel issues that it can reduce inflammation and improve their initial health issues. Other studies have shown that cold may worsen arthritis symptoms, and we all know someone who says, "Oh, I can feel the cold in my knees. I can feel when the weather's changing." So obviously listen to your body and, don't expose it to something that's making you feel worse. Remember that all these different conditions can respond differently to the exposure that you have, and maybe that's your signal to try, if cold showers don't work or the cold pot is out of the question, then maybe you just start taking a walk in the cold. Um, so in the human studies, we have cold showers that can boost energy and mood. We have cold and breathing training reduces inflammation. That's the Wim Hof. And then in the cryotherapy athletic world, we can maybe reduce some pain and soreness. Okay, so let's get to the actual practical aspects of this. So remember that cold is hormesis on the body. It's stress in a good way. It helps stress chemicals. It improves recovery and mental clarity.
Yeah, let's look at how we can really put this into practical use. This is
Yeah.
exciting.
Yeah. So again, in my personal journey, this, with the cold, it was starting with cold at the end of the hot shower. The thought for me personally to be in cold when I'm always cold was crazy. I started with Wim Hof breathing and I felt immediately better and warmer when I did that. So I would do the Wim Hof before any cold exposure. In the showers, I would go from hot to cold. First many times I could only do 2 or 3 seconds. But then every time I did it, I was, that shock value. But then afterwards, your shiver response kicks in. And that's really what we need, that sense of like shock a little bit. But then when that goes away, the shower and the post shower feeling was amazing. So you feel calm, you feel like you're more awake. There was so many benefits from it that I just kept going. I added a few more seconds each time. And then eventually I got to the cold pod and the cold immersions. But it took me a very long time with the Wim Hof breathing to do that. So, Kim, do you have any cold exposure stories that you've tried to do or been exposed to?
The main thing I've done is the showers, like you're talking about,
Yeah,
just because that's been most accessible
yeah,
in my day. So
yeah.
that's one thing that's really nice. It is accessible, and now that it is winter, you can maybe take advantage and um, go outdoors. Like some people can start out with like taking walks outdoors. Dr. Rao, I know that you're very passionate about, and both so am I, but that morning light. Like maybe it is that you combine that cold exposure in the morning and trying to get that light in the morning. That Wim Hof breathing, like you could go out, you could do that before you walk outside. It helps keep you warm when you are cold. I mean, like don't do this if you're in the water, but like, you know, as you're prepping to go into the water or before you're going outside doing those Wim Hof breathing. Because I know in my sessions too, it's like I've been hearing, well, how am I supposed to be getting morning light? It's cold outside, right? But this is where you can combine both of those two things.
But remember that, and we'll talk about this too, but you can dress warmer, right? So you could wear more layers. You can have a hat on. You can have gloves on. We're not asking people to go out without any sort of protective
Right.
gear. But if you do, it is amazing to kind of walk with that sunlight in the morning and the brisk air. And it's so quiet. It's so pretty out too when it snows. And I don't know, I have fallen in love with the concept of, I'm not saying I love winter more than summer or anything, but I dreaded winter for so long that now I'm at least excited to kind of try new things in the winter. And kind of my attitude has changed since I've learned about all the benefits with cold therapy. But let's just spend a minute on talking about cold showers
Yeah.
because that also has a gradation. And we want to make sure people understand that it doesn't have to be absolutely freezing. And cold showers is a gradual exposure. The water temperature can be as high as 68 degrees and as low as 50 for the starting. For people who start, you can start with 1, 2 seconds and work up to 30 seconds at the end of a warm shower. You can go 1 to 2 minutes. You kind of build a tolerance. Again, this hormesis effect, which is your body adapts, and you can do it frequently. You can do it 3 days a week. You can do it daily. And so most research showed that there is this norepinephrine, dopamine, immune activation, and even in the mild range of changes. So this is really exciting. And Sodberg's principle, the woman who does all that research, is even if you're doing, in Denmark and Norway, they do a lot of sauna and cold. They go back and forth, back and forth, back and forth. And the concept is to end with the cold. So Andrew Huberman has a wonderful podcast. He speaks a lot about cold therapy, and he talks about how to do it, when to do it. He goes into great details about going from cold to hot, cold to hot, cold to hot, but ending with cold. And I don't know how many of us have that time to go back and forth like that, but I think even if you just do it one time and end, you'll start to see some benefits. Um, so eventually, like I said, this is the woman in this happily lying in a bath of cold ice, which is not what I do. I am sitting in a cold pod, which I will take a video of it, and hopefully it'll be attached to this webinar. And I sit with my chest is up out of the water. The water itself is in something called a cold pod, which is, I think, about $100. It looks like an exaggerated trash can, and you can cover it. And it's lined inside. And in the summer, we throw ice water bottles in there to keep it cool. And of course, now in the winter in Maryland, we don't need to throw anything in there. So there's a temperature where if it's iced over, I'm not getting in, and I don't recommend anyone get in. But it's something where you can do for as little as, 10 seconds and go up to 3.5 minutes. I do that about 11 minutes a week. And so my way of doing it is about 3 times a week, 3.5 minutes each time, and I'm done. And sometimes I'll do the sauna before and get into the cold pot after, but it is something that I've worked up to. And so this is not me laying in this, but I would love to be that calm in ice. So I think it's that hormesis that will eventually get your body more and more adjusted. But 3 years ago, if anyone told me I was going to go into a cold pot, I would have thought they were absolutely insane with how cold I usually feel. But my tolerance for cold has actually gone up significantly, that most of my family and friends are like, is there something wrong with you? Like, how come you're okay in this cold temperature? I mean, I've always loved to ski and things like that, but you're moving in it. But to actually walk in the cold is something I actually look forward to every day. Um, so these cold plunges, remember, it's also their ice baths. Very, very, very critical. People know what okay is. And don't look at these influencers and be like, oh, well, they're doing it at 32 degrees or 35 degrees, so I'm going to do it. No, please be very, very mindful of how cold that water is. So the cold plunge water temperatures for beginners can be even as 50 degrees or even higher. I mean, Kim, you're going to talk a little bit about what happens in, hormones, but your duration, like I said, is 11 minutes a week. I would never go above 10 minutes a time. I would try to keep it 2 to 5 times a week, based on the research, but 11 minutes a week is really all you need. But remember, be very mindful of hypothermia and the strain on the heart, and get the clearance if you have any medical issues.
I mean, I want to say like it's really nice to know, right, that it does not have to be like freezing water, like you're talking about with that, like breaking the ice before you get it.
Terrible.
Yeah.
That's just
So I
not,
think that's
that's not for
great. I
me.
mean, that relieves relieves some stress for me. And then as far as like the hormone piece, like what you're saying, like how many times a week, something to think about for women, like that week before your period, like if you're still menstruating, it's really important like to be giving your body like some calmer exercises, and doing something like this might be just a little bit too much for you, so it might be something to consider to do those other 3 weeks of the cycle, and try to avoid it maybe that week before the cycle. But this is something you could talk to Dr. Rao about too, a little bit more, your physician, just from progesterone is something that increases before you get your period, and it doesn't like a lot of stress. So this might be something that would prevent your progesterone from going up and having calm your body, and then you get your period. So if you'd like to know more about that, we can definitely talk more about that another time.
Yeah, I think it's important to also pay for women to pay attention to how their cycles are responding to
Mhm.
their interventions, right? So if you do see signs of, more cramping or more PMS or, something you're like, well, she told me that my mood was going to get better, but actually it's getting worse. That's
Right.
that's a concept worth investigating, saying maybe we're doing too much too soon, too quickly, too cold, really pay attention to some of those things as well. So this is a picture of the actual cryotherapy, sorry, not cryotherapy, the cold water whole body treatments that are available in gyms. You go whole body in there. Typically, your head is sticking out. I did this for the first time, I don't know, 10 years ago, and I thought I thought there was something wrong with me when I got in because I was just so intensely scared to do it. But then when I did it, it was awesome and I felt great. And they do this post workouts. You feel less soreness. You feel more like your muscles are more resilient. But it does need supervision. Have you had any clients, Kim, that work on this?
I have had some that have gone to gyms and really enjoyed it. And like even like joints and things, obviously it's a N of one experiment for these people, but like their joints would feel better like after an experience like this. Definitely.
Yeah, so whole body cold therapy um, is is crazy levels of negative. It's 2 to 3 minutes in a clinical setting, and it's very short term. It requires supervision, and we have to wear proper gear when we're getting in there. So this is something to try if you feel, adventurous about it. So how do we start exposure, Kim? What do you think is a great starting point for people who've never done this before?
I think, like you mentioned earlier, it's really taking that walk right now. Like, take advantage. We're not talking about, it's not June, right? So, around where I'm at this weekend, it's going to be negative on Sunday. So we are definitely getting in those colder temperatures, and it's maybe is that you put on that protective gear, like you talked about, like their jacket and all that, and go outside for a few minutes, and then come back in, and you can feel that be reinvigorated. It's free. This is something you can do. And like we said too, it gets you out of the house so that you get some of that light from the sun as well, which is something that we really lack in the winter, I feel like, especially,
Yeah,
up in these latitudes. So
that's great, great points. So the cold exposure winter walks, it can be temperatures 32 degrees to 50 degrees. So it doesn't have to be freezing cold. 50 degrees is quite comfortable. Obviously, wear protective clothing, 10 to 30 minutes. Go if you want in the middle of the day, because that's when the sun's out and it's a bit warmer. And if you're moving your body, you have less chance of becoming hypothermic, like walking or hiking, since your movement will generate heat.
yep. And like we said, you're getting that nature too. Like you're getting exposure to nature. Um, all of those things I feel like we're severely lacking in the winter. So.
Yeah, and seasonal affective disorder is real.
Mhm.
There's definitely neurotransmitter changes that happen when we have darker days. The sun sets at 5 some places, maybe even earlier. We leave the house, it's dark. We come home, it's dark. So we have to make a conscientious effort to get outside. So I think that, three major things we can think about in the winter, especially if your temperatures are changing, if you're in an area where you have colder temperatures, you're getting sunlight, you're getting the nature if you're outside, all the benefits of nature, trees, and then you're getting the cold temperature. So those three things we can hit, and it's very, very important to kind of be mindful of the lack of hours in the day that we have sunlight, so you can maybe make an intentional change in your lifestyle to go out and experience some of these things more. So we're coming to the end of the didactic part. We'll have a Q&A after, but just in summary, remember that there's a hormetic response that occurs in mild to moderate cold. Extreme cold is not necessary to get all of these benefits, right? Tiptoe in, start gradually. Again, just starting with a walk or a 15 to 30-second cold water after a hot shower activates your brown fat, catecholamines, your neurotransmitters, and just try it a few times and you'll see that even small steps make some changes. And just be cautious, just kind of avoid serious changes because if you have a medical issue or if you have chronic illness or cardiovascular disease, please get clearance before you try any of these things.
And so just really go slowly, right? Small steps are best. And it avoided, like Dr. Rouse said, like avoid it if you have heart issues without medical guidance. So definitely talk to your doctor and stop if you start to feel any numbness, chest pain, or dizziness. Like just stop right away or get back inside if you're outside.
Very good point. Sometimes people are like, oh, this is just part of the journey. And, sometimes a very big common complaint is peripheral changes. You feel like burning and tingling in your fingertips. That sometimes can be normal. That's a normal response. But you should never feel chest pain. You should never feel dizzy. You should never feel uh, any sort of symptom that you're going to pass out or that never is normal. So please pay attention to those kind of things. Um, so overall, guys, I hope you understand that this can be a really valuable tool and it really varies person to person. And so please start slow, go slow, and basically take into consideration any feedback you get from your providers.
All right. Thank you.
Thanks.
We'll see you at the Q&A. Right.
Yes, thanks for listening.